Hello, and thank you for listening to the CE session titled Developing Research Questions. My name is Elaine Wing, and I'm an associate professor with Idaho State University LS Skaggs College of Pharmacy. Hello, and thank you for listening to the CE session titled Developing Research Questions. My name is Elaine Wing, and I'm an associate professor with Idaho State University LS Skaggs College of Pharmacy. All right, so acknowledgements and disclaimers. This session was funded through a Patient-Centered Outcomes Research Institute, or PCORI, Eugene Washington Engagement Award. And the views, statements, and opinions presented in this session are solely the responsibility of the author and do not necessarily represent the views of PCORI, its Board of Governors, or Methodology Committee. I want to additionally thank the Idaho Society of Health System Pharmacy for their collaboration with us to host and make available this recording. All right, so today we're going to briefly cover patient-centered comparative clinical effectiveness research, or CER, research idea and question generation, and lastly, discuss refining the research question. Throughout today's session, you will be completing the worksheet that was available with the material, so please make sure you have that available. It is available for download through ISHP's Lecture Panda website, and so we'll be working through that worksheet, and so if you want to go ahead and take a couple moments to get that out now, that would be perfect. All right, so for pharmacists, our objectives for today, after listening to the session, hopefully you'll be able to recognize 3 questions to ask to help develop a research question, define components of the PCOTS framework, define the finite criteria for evaluating a research question, and lastly, our interactive component for today, working through that worksheet, is going to be to develop a patient-centered CER question applicable to your practice. And for technicians, very similar to our pharmacist objectives. However, the first objective is slightly different. And so for technicians, I hope that after today's session, you'll also be able to list origins for ideas when developing a research question. All right, so I mentioned that worksheet. If you haven't gotten it out, this is a perfect time to do so. Go ahead and take a look at that worksheet. And first, I want us to take 2 minutes to think about what topics or areas of research are of interest to you. And if you've never done research before, that's completely okay. But just think about the things that you see every day in your work or your practice and questions that may have arisen or things that just kind of pique your curiosity. So I'm going to go ahead and set a timer for 2 minutes, and then I will come back and join you all in 2 minutes. All right, well, it has been 2 minutes, so welcome back. Hopefully, you have a couple of ideas written down. So, in the coming slides and throughout today's session, we will work to develop some draft research questions. And so, I want you all to recognize that all of your research question ideas may not come to full fruition, but this is just a starting point, right? And so, um, ideally, one of those ideas will eventually turn into an implemented project. So you may have to shift and transform your thoughts to make stronger research questions, but you can still stay within your topic or area of interest. And so that's what I wanted us to start with, just kind of articulating and writing down just the areas of interest that are to you. And so even as a research question may transform, ideally you'll kind of stay within that research area because we want you to do something that you're interested in. All right, so like I mentioned briefly earlier, our first session is going to be, our first topic today is going to be patient-centered CER, or clinical comparative effectiveness research. And so if you are watching our other CE sessions as part of the CE library that we're developing, there is a whole nother session on patient-centered CER. But right now I wanted to introduce us to this topic, just so that we can start thinking about this as we start to develop our own research questions. All right, so first I'm going to discuss patient-centeredness. And I think by now, right, we are all familiar with the idea of patient-centered care. And so we can take this idea of patient-centeredness, patient-centered care, and put this into PCOR, or patient-centered outcomes research, right? So it's along those same lines, doing research that evaluates outcomes that matter to patients and their caregivers. So I have some example questions down here, PCOR questions, so patient-centered outcomes research questions. So if for thinking about a patient, so if energy level is important for patients, the questions may be, well, how will this treatment impact my energy? What can I do as a patient to improve my energy during treatment, right? So what's important to patients, and then thinking about treatment options and how to keep what's important to patients at the forefront. All right, and so this kind of other half of this term when I was talking about patient-centered comparative clinical effectiveness research is this idea of comparative clinical effectiveness research, or CER. So simply put, it's comparing two or more options. These could be different treatments, services, or practices at a clinical or healthcare delivery system level. And so it doesn't need to be, just two different drugs, right? So thinking more about services, locations, how healthcare is delivered. So some examples for this, different medication options, screening approaches, or healthcare delivery models. And so we might think, does X or Y improve patient chronic back pain more, right? So it could be drug X versus drug Y, or comparing the pros and cons of two different treatment options. These would be examples of a CER. Right, and in patient-centered CER, stakeholders are active partners in the research process. And so to discuss a little bit more about stakeholders, and this figure that we have here is taken from the PCORI website and kind of shows a lot of their stakeholders in the PCORI community. So when thinking about stakeholders, think broadly about all the different participants. Okay, so as we look at this figure, I'm going to start at the top and then work my way around clockwise. So of course we have patients, and some people call them consumers, right? Consumers of healthcare delivery, of healthcare services, at the top of this figure. Then policymakers, those are the ones involved in the development of public policy at any level of government. So this could be state Medicaid level, or a policy analyst for an organization of policymakers. We have clinicians, right? So you all are clinicians. This is the folks that are providing healthcare. Purchasers, so who are the people that are purchasing health benefits for others? This could be somebody in a smaller family-run business, or maybe staff of a larger organization. And then caregivers, right? So caregivers, family members of the patients, the ones that are helping our patients, caring for the patients. And then here on the very bottom that we have here, training institutions. These are the institutions that train and educate health professionals. So we can think about a college of pharmacy, right? Who is their dean? Who is the leadership that has control over those training institutions? We have patient or caregiver advocacy organizations. These are the organizations representing patients and or caregivers. Hospitals and health systems. Many of you may work for hospitals and health systems. these are the organizations where care is delivered, right? So this could be thinking about the individuals who might represent a hospital or health system. This could be a clinic administrator, or maybe the CEO of the hospital. Payers, right? So insurance. Payers, as we know, can be both private or public. In Idaho, we have the Blue Cross of Idaho, or we have Medicaid. And then lastly, at least on this figure, we have industry. So industry, these are the companies that make and create materials that are used to deliver healthcare services. So I think oftentimes when we think of industry, we think of the pharmaceutical industry, right? They are the ones that are making the drugs, but we can also think about manufacturers of devices, who are the ones that are creating the electronic health record that we use every day, right? Or mobile apps. And so this is kind of a quick snapshot, just to help us think broadly about all the different stakeholders that might be involved. And like I said, this figure is from PCORI, and so these are the ones that they especially like to highlight in their PCORI community. And so kind of putting this all together, right? So I started this section by talking about PCOR, patient-centered outcomes research. We talked about comparative clinical effectiveness research, so that CER part. And so putting this all together, we have patient-centered CER. And so I think this is a great figure that hopefully highlights just very briefly what we've talked about so far in this session. But as it says here in this kind of box to the lower right, patient-centered CER is a type of comparative effectiveness research that compares outcomes that matter most to stakeholders. All right, so that ends kind of our brief introduction to patient-centered CER. Like I said, if you're joining us in our other CE sessions, there will be more on patient-centered CER. But our next topic is going to be research idea and question generation. All right, so one of the technician objectives for today is to list origins for ideas when developing a research question. And so even though it's only a technician objective, it really is applicable to everyone. And so here are just some places to start when you're trying to brainstorm, what could be your research question. And so what really helps is just having some foundational knowledge of the field and some background knowledge. And what can help with that is a literature review that allows you to know what's been done and what can be done next. All right. And so we'll talk more about literature review on the next slide as well. Okay. And then you can think about addressing a need, right? So you can think about what are the medical or public health needs. There's this quote, right, that is, necessity is the mother of invention. And we may not be inventing something, but we are trying to get to a better place. So what are the needs for better care and unanswered questions to provide that better care? And then lastly, being aware of new ideas or techniques in your field, and how we become aware of these things, we can do so through many different ways. So one is just being inquisitive, like asking why. Why is something done this way? Why was this developed? Oftentimes it's like asking 5 whys, right? And that can also help you refine your question. So be inquisitive, ask why, and that can really help generate ideas. Attending conferences, kind of this idea of networking, right? Just talking with others can provide sources of great ideas as well. And then seeking out collaborations, I think that kind of aligns with networking, attending conferences as well. And then you will also have a lot of experiences from your day-to-day work. Potentially, maybe you're teaching, you're precepting students, you're interacting with patients, you're interacting with your colleagues, right? So what are the questions that come out from your everyday work and all the interactions that you have? And then lastly on this list is, if you can, I know that you all are busy, busy pharmacy professionals, and you might not even have time to use the restroom, right? But if you can, if there's moments in your day that you can allow for time for just creativity and just thinking and letting your thoughts explore and go to different places, I think can be very helpful in the brainstorming process. And then lastly on the slide, I do just have on the right this kind of figure just to remind me all to share with you, just jot down your notes and share your ideas, right? So sometimes you are very busy, but you might have a fleeting idea. I try to keep an idea notebook or an idea piece of paper, just write down ideas as they come or as I'm talking with folks. Maybe I don't have time to fully explore those ideas when those ideas come, but then I can come back and think about those ideas and see if those develop into research questions as well. All right. So I mentioned literature review and idea generation. To me, these go hand in hand, and it's really a dynamic and continual process to help get a focused research question and a testable hypothesis, right? So I have, an inkling of an idea. I'm looking at the literature. What does the literature say? And then kind of building off the literature and then continuing to refine my idea in really a dynamic process. All right, so why literature review? Doing literature review helps you understand your topic in greater detail, and as previously mentioned, provides a knowledge foundation. It can also help you avoid repeating questions, right, that have already been done. Or you can take your questions and studies that have already been done, and instead of just repeating them, build upon them to answer the next question or tailor the question to your population, right? So I can't say enough about literature review. I think it really helps just to know what's out there, and refine your question and then help with your own approach and methods, right? All right, searching the literature, not too much to say in here. I think in the US, our go-to source is Medline or PubMed. So Medline via PubMed. So we know we have your primary literature, but also think about poster and presentation abstracts. Maybe there's some meetings or conferences that really specialize in your area of research, right? So check out the posters and abstracts from that meeting, especially because, there is that publication delay. So that can be a great place to see what new things are coming out there that maybe haven't been published yet. And then, of course, you have your secondary and tertiary resources. So looking at guidelines, news and updates, right? So different websites, organizations kind of give you those news and updates as well. All right. So considerations when reviewing the literature. I already touched on some of these topics, but as you review the literature, think about the gaps. What type of gaps are out there, right? Because you can fill in those gaps with your research question. And a key part of any article to help as you think about these gaps is the discussion section, right? I think the discussion section is really where the meat of an article is. It's where the authors are putting their work into context of the existing literature, right? And so oftentimes they'll talk about the other literature, they'll talk about how their study helps fill that gap, but they'll also talk about limitations and next studies. And then you can also think about how you can translate work that's been done to a different field or disease state of interest to you as well. All right, so another activity, I know that was a lot of slides, some review in there as well. But I do think as you guys started thinking about the first question, which was just ideas of research ideas or topics of interest to you, I think it would be helpful just to take a quick peek at the literature, right? I know 5 minutes is not nearly enough time, but as we work through today's activities, I think that this will help you just get an idea for what's out there. You can try different search terms. And so I am going to put my timer on for 5 minutes, and then we will join again in 5 minutes after you have some time to look around the literature. All right. Well, hopefully that 5 minutes was just enough time to help get your thoughts percolating. Like I said before, you'll obviously need more than 5 minutes, but for today's activity, I want to do at least to take a look to see what was out there. All right. So, next, as you are exploring your ideas in the literature, three questions to ask yourself, right? And so this is actually one of the pharmacist objectives, things to ask yourself as you're looking at the literature. So, one is, what do I want to know? Two, what do I currently know? And three, what is unknown, right? So that question three is kind of really getting at what are the gaps, right? And so that's where kind of help focus and refine your question. You're thinking about what do I want to know, right? So maybe you are looking at the literature, you're kind of answering what do you currently know, but then what are the gaps, right? How can you help fill those gaps? And so again, we're gonna have another break here to start thinking about these questions. And so we had that first question we looked at, what are your topic areas of interest? Now you've had the chance to look at the literature. And so now I'm going to give you another 5 minutes to complete question number two on the worksheet. And so feel free to also use this time if you need to do some continued literature searching so you can actually answer these questions. So like we did before, I'm going to go ahead and put my timer on 5 minutes, and we'll come back together soon. All right, well, welcome back. Hopefully, with the literature searching and answering these three key questions, you have some good initial thoughts. And now, kind of thinking what's next, right? So, you want to take all those good thoughts that are floating in your head or on your paper and transform these into potential research questions. So as you do this, ask yourself questions that begin with what, why, and how, right? So we know those kind of standard question words. And so taking all your ideas now and then start to just, brain dump, right? At least for me, I just want to get all my thoughts out and just think about what are all the potential research questions that can come out of the things that you started thinking about. And so we're going to take another 3 minutes to do this and give you guys time to really jot down all of your ideas. Okay, we are back. And so this last worksheet question kind of ends our section on research idea and question generation. And then lastly for today, we're going to talk about refining the research question. So you all just finished creating some possible research questions. Now I want to tighten your ideas and the questions that you may have. And so kind of have this example here so you guys can think about applying these same ideas to your own questions that you have. So with a good research question, you want to transform that question into an objective and testable hypothesis. So if we look at this example, right? So maybe you first want to start off with wanting to explore the relationship between anticoagulant prophylaxis and VTE. So this is great. We have some ideas within this question, but we need to refine it more. So we can add some more details to this and spell out, what anticoagulant do we mean, and maybe the patient population. And so here in the second box, the question transforms into Does prophylaxis with low molecular weight heparin lead to better outcomes in critically ill patients with septic shock? Okay, so it's improved from our first question, but we can still add more details and get us to this final question. So in this example, our final question we can see has more detail, right? So it says, does prophylaxis with enoxaparin lead to fewer VTE events in unfractionated heparin in critically ill patients with septic shock? So hopefully this example highlights how we went from this first very general idea to a very refined, specific question. Right, so thinking about that example, I want you to take a look at your specific questions that you created in our previous breaks, and we're going to try to narrow down your ideas as well. So we're going to take another 3-minute break to do question 4 on the worksheet, review the potential questions that you have, and then we're going to try to figure out if there's a couple questions that we really want to take from there and then further refine. So you can ask yourself, is there a question that stands out? And are there questions that need to be answered before you can even answer your standout question? So we'll do another 3-minute break to look at your questions on the worksheet. All right, well, welcome back. We will come back and revisit what you've recently done, but before that, I want to discuss PCOTs. Many are familiar with PICO, so PCOTs is just an extension of that. And so one of our objectives for today is to know the components of PCOTs. So I know many of you may be familiar with the PICO framework as well, so we're using PCOTs today. And so as a reminder, the PICO or PCOTS framework is a way to structure and organize clinical questions. We often use it to guide literature searches, or we can also use it, as we are going to today, to set up our research question. And so let's break down the PCOTS components. P stands for population or patients. I is our intervention. C is our comparator. And you may not always have a comparator in every situation, so it may be standards of care. Along those lines, maybe you're not actually doing a randomized control trial or looking at an intervention itself, but what are you looking at to see what the impact of whatever it is that you're testing might be? So it might not always be that you're making an intervention, but you're making an observation of some type of variable. All right. O is your outcomes. T is time frame. So outcomes that can happen within a certain period of time that you're interested in. And then lastly, setting. This could be your outpatient setting, your clinic, inpatient, or anything else specific to your practice. All right. And so again, back to this worksheet. I know there's a lot of pauses and breaks, but really wanted to make this session today interactive and to get you guys thinking about that research question, because I do think it really takes time and some noodling and some exploration. And so um, now we want to kind of narrow down your research question, right? So in question number 4, you identified your standout question. And now we're going to articulate that question using the PCOTS framework. So take your ideas, take your question, and you should be able to break down your question into these different components. And like I said before, it might not necessarily be an intervention, right? It's an observation or something that you're looking at to see what the impact of that is. And you may not have a comparator. It could be standard of care or it could be no comparator, but at least think through the different parts of the PCOTS framework, and we'll take 2 minutes for you to be able to articulate your question using this framework. All right, so now you hopefully have a complete question that you're able to define using PCOTS. And so continuing on with this section that we have, we are going to take a step back and reflect on that question and use the FINER criteria. So this FINER acronym is a set of criteria used to evaluate a research question. And this also is just one of our objectives for today. And so just going to kind of break down what are the components of FINER, right? So is it feasible? We can think about feasibility in a lot of different ways. It might be adequate number of subjects who are participants. Do we have the technical expertise we need? Do we have access to data, right? And so this could be maybe you are needing to do manual chart review, right? Is that feasible? Can you extract data from your EHR? Is it affordable in terms of time and money, right? And then is it manageable in terms of scope as well? So next we have, is it interesting? Right? So I'm thinking also about your personal interest. You're going to be spending a lot of time working on this project, so it needs to be interesting to you. And then also thinking about, is it interesting to others, right? Will others be involved? Who are the stakeholders that you also need buy-in from? Is it novel? And novelty is definitely important to consider, but I think you also need to consider the current stage in your career, right? So, um, the novelty might depend on where you are in your research career. And so your project doesn't need to be totally original or groundbreaking, right? So earlier we talked about maybe you can take some other ideas that you found in the literature, you can tailor that to your population or your work setting as well. And then some just other considerations with, is it novel? We do want to try to make sure we're filling some type of knowledge gap. It could be knowledge gap for your particular area of practice, or maybe one that's more applicable to the entire field as well. And then E for ethical. So is it going to be allowable by an institutional review board? Even if your research question maybe it's kind of more along the lines of quality improvement, obviously needs to be ethical and doing no harm to patients. And so with that, you can think about what are the risks and benefits, as well as health equity. And lastly, is it relevant? What is the impact that it will have on care? So again, when looking at the FINET criteria, it's important just to acknowledge and recognize where you are in the research process. Some of this may be just starting this process, so you might not have, life-changing research, but ideally, the question that you have, take a step back and apply this FINET criteria. Okay, so our last question on the worksheet is question number 6. We're going to take another 2 minutes, reflect and gather feedback on your question. Doesn't meet that FINET criteria. If you're watching this CE session or this recording, maybe you're doing it in the office, feel free to turn around and ask one of your coworkers or ask someone else that you may be with to get their feedback on your question as well. And that might also help spark some additional ideas. So we'll do 2 minutes. This is our last break, and we'll see each other again soon. All right, and for the last time, welcome back. I hope you've enjoyed some of these interactive sessions. Time for you to work on this worksheet, whether you're typing or actually jotting down your ideas, and then kind of depending on where you are in this process, taking some time to further explore those ideas, further explore the literature, and continue on with this process. But for today's session, we are gonna close things out. So let's begin with a couple key take-home points. So we began by discussing patient-centered outcomes and comparative clinical effectiveness research, or CER. Patient-centered CER compares 2 or more outcomes that are important to patients, their caregivers, and the stakeholder team. Right, and so I think this image here that we have on the right really helps kind of focus in and kind of that main take-home point for that first session. We next discussed research ideas and question generation. A key part of that is knowledge of the field and doing that literature review. Three questions to ask yourself as you focus your question to a testable hypothesis are, what do I want to know? What do I currently know? And what is unknown? We discussed two different acronyms. The PCOTS framework can be used to structure and organize your clinical research question. And lastly, you can use the FINER criteria to evaluate your proposed question. All right. So lastly, our assessment questions for today's session. So first is, where can research question ideas come from? Select all that apply. A, being familiar with existing literature. B, guessing randomly the next big idea. C, identifying and attempting to address needs. And D, keeping up with new ideas. All right. So the correct answers are A, C, and D. Well, you could guess randomly the next big idea, right? So that's option B. That may not be the best approach. And we did discuss the other three items, options A, C, and D. And so instead of guessing randomly, which is option B, it would work better to be familiar with the context and the landscape, right? So that's kind of doing that literature review. Then you could potentially make some educated guesses based on your knowledge. All right, question 2. Which of the following is a question to ask to help focus your research question? A, what assumptions can I make? B, what do I want to know? C, what resources do I need? And D, what stakeholders agree with my opinion? All right, and so the correct answer is B, right? So we talked about those three questions that you can ask yourself to help focus your own research question, which are, what do I want to know? What do I currently know? And what is unknown? All right, so question number 3, what does the PCOTS acronym stand for? And I'm actually not going to read all of these options. I'll let you take a second to read through your options. All right, and hopefully you are thinking A, because that is the correct answer. PCOTS is the population, intervention, comparator, outcome, timeframe, and setting. All right, and then our last assessment question, question number 4, what does the FINER acronym stand for? All right, and again, the correct answer is A, feasible, interesting, novel, ethical, and relevant. All right, so a lot of the content from today's session comes from PCORI Research Fundamentals Module 1. I highly encourage you to check it out. There's a link to the slides, or you can just do an internet search on PCORI Research Fundamentals. Module 1 is developing research questions. If you're continuing on this series with us, we will again be highlighting some of the content from the PCORI modules as well. And so if you're interested, the PCORI module itself takes about 30 minutes, and you can adjust the speed to that as well. And so lastly, feel free to email me with any questions at elainewing@isu.edu. Thanks for listening today, and definitely feel free to reach out if you have any questions or want to discuss more.